Lions! Tigers!
And bears!
Oh my! Hi, I'm Dr. Kyson Frank.
And I'm Dr. Craig Farney.
We're the doctors at Docerelife Center.
But today we're here at Sedgwick County Zoo as the Doctors of Oz.
To pull back the curtain on another chronic illness.
Called
Lyme disease.
What is Lyme disease? It is the most common tick-borne illness in the United States. It is most typically caused by a specific type of bacterium called a spirochete that's named Borrelia burgdorferi. And it can cause a myriad of symptoms. It can cause skin problems, it can cause heart problems, it can cause nervous system problems, and it can cause joint problems. How was Lyme disease discovered? It was actually first discovered and diagnosed in the town of Lyme, Connecticut in 1975. But what's interesting is in the early 1900s there was a manifestation of what's called erythema migrans, which is the classic sign of Lyme disease that was seen in Europe. Then, as I said, in 1975 there was an outbreak of what was thought to be juvenile rheumatoid arthritis. In 1982 they actually discovered the bacterium Borrelia burgdorferi in the midgut of the deer tick. And then in 1984 it was found not only in the bloodstream but also in the skin lesions of patients with this condition. The infected tick can transmit the spirochete to the humans or animals it bites. Left untreated, that bacterium will travel through the bloodstream to various organs and establish itself and can create a myriad of symptoms, and some of them are severe. Lyme disease is a multi-system inflammatory disease. First it starts with the skin, spreads from there, it can go to the joints, to the heart, and even to the nervous system. So the most common tick that actually spreads Lyme disease is the deer tick, which is found in north central and northeastern America. But there are also a couple other types of ticks that can spread it as well. You have the Lone Star tick, which is found in Texas, and then you also have the Rocky Mountain tick, which is found obviously in the Rocky Mountains and can not only spread Lyme but also Rocky Mountain spotted fever. So what are the signs and symptoms of Lyme disease? The most common is what's called the bullseye rash, or what's also known as erythema migrans. It occurs within the first 3 to 30 days and can grow up to 12 inches in diameter. Other symptoms include fatigue, fever, chills, body aches, joint pain, and many more. Lyme disease is also the great mimic disease because it's often misdiagnosed as another condition that may have very similar symptomology. Things such as chronic fatigue syndrome or psychological disorders like bipolar disorder, obsessive compulsive disorder, or depression. Things like rheumatoid arthritis, irritable bowel disease, or many more. Another important factor to consider with Lyme disease is other underlying or coexisting conditions that are going on at the time of the infection. The overall summation of burden on the body is an important factor in the severity of the symptoms a person experiences with Lyme disease. Things such as problems with methylation, transsulfuration, acetylation are all common in Lyme disease patients. Some of the factors to consider are things such as mold sensitivities, food sensitivities, chemical sensitivities, how well the body is detoxifying, or do we have a problem with ammonia, do we have any issues with neurologic conditions and other conditions such as that. If you're interested in digging deeper into how Lyme disease started and the etiology of it, here's a couple of references you might consider.
Hi, I'm Dr. Kyson Frank, and I want to talk to you a little bit about how we deal with Lyme disease here at Docerelife Center. First of all, I'll give props up to any doctor who's willing to try to tackle this. It is a tough issue that is very prevalent in the United States, more than most people know. There's a lot of people who suffer with it subclinically. It doesn't show up in the Western blot or the ELISA testing or any other form there. So to get this diagnosis is hard, and oftentimes people go undiagnosed with it and they suffer with it for a long period of time. And those are the ones that we're able to help, the ones that have been missed or misdiagnosed or haven't been able to find the relief. So there's two main issues when we deal with Lyme disease. Number one is actually getting the diagnosis to actually know that's what the issue is, or it's finding a relevant treatment. It's one thing to find, it's a whole other animal to try to treat it. That's where a lot of people run into issues. So many of these patients who haven't been able to get the diagnosis or haven't been able to find the treatment that worked for them, they've had to become their own health advocates. They've had to go search out Dr. Google. They've had to go find answers and solutions in other places because their doctors have failed them. They haven't been able to get the results they're looking for. And so these people are really seeking, they're really earnestly looking at them, at what's going on in their lives, and they get dismissed so many times by doctors because it's not given to them by a professional. So looking at the epigenetics of Lyme disease and looking how methylation and different genetic variants can influence different people who have the infection, some people may never even know they have it. They may not have any signs or symptoms of it, while others, they suffer immeasurably from the toxic load and everything that's on their body. It's a long journey to reestablish and get your health back. It's not just as simple as killing off bacterial infection. If you do that, you don't try to reestablish all the other systems of the body, you're going to end up with a lot of herxing and a lot of pain and a lot of angry patients. When I deal with patients, sometimes we actually have to get them well enough to actually get them well, which means there's a lot of things that we have to deal with as far as different tissues and different systems of the body that aren't functioning correctly. I can't have you start detoxifying and trying to clean things up if your detoxification system isn't working. It's like taking your trash out to the curb every week and the trash never comes, it just sits there and accumulates. So we've got to be able to get these systems working again, so when I start going after different aspects of Lyme or any other chronic disease, we're able to actually clean that up. So a lot of this comes down to your genetic makeup, the methylation system of your body. So when we look at the genome of the body, your genetics, how well do you actually go through and detoxify? How well do you go through and methylate? How does your neurotransmitters work? How do you clean these things up? Because based on these things, it depends on how we have to take certain approaches to helping you get better. One thing that it makes it tougher is dealing with different types of stress in the body, because stresses can actually exacerbate or express or suppress certain parts of your genome. So what kind of stresses are there? Well, there's chemical stress, obviously toxicities that come into the body. We have environmental stress, such as the different types of magnetic fields from 5G, all these different things that come in and actually start messing with our body, even Wi-Fi. Then we have structural stress. Have we fallen? Have we hurt ourselves? Are we on our feet all day long? What's going on structurally in the body? Do we need an adjustment? Do we need to get things put back in place? Do we need to start looking into mental, emotional, different areas here that'll play into how you feel about yourself, how you actually start to clean yourself up, and actually how you start to heal. So I'd like to talk to you about the expression of variants or hidden variants in the body. So when we're talking about methylation, how the body actually expresses its genome. There's certain people that have certain variants that allow them to have the potentiation to have more problems when certain stressors or certain events happen in the body. In this case, what we're talking about is when Lyme disease comes in, the toxins are being released by the Borrelia burgdorferi bacteria. Some people don't detoxify very well, and it starts to build up and create other issues, and this is where they start to have a lot of problems. Other people, they may have the Borrelia burgdorferi and they may never know they even had it because they don't experience the toxicity issues. So when we come in and we actually start looking at the genome, and we actually run a genetic test to actually look for these certain variants in your genome to kind of tell us what you may have a potentiation for having an issue. Well, we have to come back and we have to monitor changes of what we're doing with something called an OAT test, or organic acid testing. This looks at the byproducts or the outcome of certain dysfunctional pathways. So when we get these pathways working correctly, we should see these things fall back into balance. The other side of what we can do with our practice is we use kinesiology testing to actually see what different variants are actually having issues at this point in time while you're in the room, and figure out how to change that. Looking at other types of chronic infections or things like that that may be pushing or changing these different variants, and removing these stresses so you can actually methylate correctly and have your genome working for you in the best possible light. It is better for us to go through and balance out these systems, removing these hidden infections, toxins, things like this that are actually causing issues, versus just treating the symptoms of toxicity and taking binders and things like this that may give us some temporary relief, but they're not going to actually fix the pathway. So we're looking for long-term healing, long-term health, actually be able to live your best life. We have to reestablish and get these pathways working correctly for your best ability. So from your mouth to your anus is an entire long tube in your body. And understand that everything in that tube isn't technically in your body. So these parasites can live outside of your body, although they're within the tube within your body, and keep releasing toxins and keep messing with your gut lining, which affects your digestion, food allergies, all kinds of other things that can create all kinds of havoc in your body. And so being able to deal with these things properly in conjunction with actually having to treat the Lyme disease and try to find healing, that's a big thing that we have to look at and really dive into and make sure that we clear those things out. So certain infections, or hidden infections, or stealth infections as they're called, they're very problematic. Can be anything from viruses to parasites. I usually think parasites are one of the big ones that we have to look at, because they can become infected with the Borrelia burgdorferi. They can keep releasing it back into your body. They become a safe harbor. And so by finding these things and dealing with them, it plays an important part of your healing process. I've dealt with stool tests for a long time, and I can't tell you how many times people have come back with a negative on their stool test, and yet they still start releasing worms in their stools and everything else. We start to see these things playing out. So looking at stool test as a end-all be-all to actually ruling out whether you have parasites or not isn't a safe way of doing it, because you could overlook hidden infections that are there and not realize that those are the underlying cause, and then move on to other things. You start spinning your wheels trying to find answers. I've had a lot of patients that have come in and they've had scopes and they've had scans, they've all these things done to kind of try to find parasites, and they haven't found anything. Even imaging from MRIs to CAT scans, and they haven't found anything. They come back negative. And I'm always amazed at how they miss these things. When patients come back, 2-3 weeks later after we start treatment, they send us pictures of worms that are substantially long coming out of their bowels. So they're hidden in there somewhere, and so we've got to go in and find them. So why Lyme likes to hide in the safe harbor of parasites before it can be re-released into your body. And you often see this with patients who've had Lyme and they get great results. They do the antibiotic route or some other route and they start feeling really good. Life's going well for them again. And then something happens. Some stressful event happens and all of a sudden they go back down again. Lyme flares back up and they have remission. And so they're struggling again. So how does this happen? Why does the body allow the parasites to stay in here? Well, there's a triad we like to talk about between Lyme disease, heavy metal, and parasites. So the more heavy metals you get into your body, the greater the breeding ground you have for parasites to live there. And the body allows the parasites to stay there because it's sort of helping. It's this uneasy relationship where the parasites absorb the heavy metals and allows them to stay there. And if you kill them off too quickly, they dump all the heavy metals, which can kind of make you sick. So it's kind of like a terrorist with a time bomb on his chest. You got to be careful on how you get rid of them before they blow up and they create a lot of other issues. So dealing with this triad of things means we need to remove any of the heavy metals in our diet, in our water, in the air, smoking, any type of pollution that we're dealing with that's getting into our bodies, allowing this to become a breeding ground for these types of infections. So there's an object of patient responsibility that comes into this. As the doctor, I can only do so much. I can recommend different remedies, we can go through different spiritual things, we can deal with mental and emotional aspects, but at the end of the day, it really comes down to the patients putting in the work and really driving through there. Now I can say that because I've been through Lyme myself. I've had to go through it. I spent most of my life overcoming Lyme. Part of the reason why I became a doctor, part of the reason why I've gone down the pathways that I've gone down is because I've gotten results. When dealing with Lyme disease, sometimes there are some toxic relationships that develop with caregivers. Sometimes a toxic relationship is actually with the patient themselves. They don't like to get better. They like being taken care of. They want to be the center of attention. And that develops from a young age and they get used to that. And so that's something we have to work through. We have to go through and use neuroplasticity and other things to kind of change that pre-programming in the brain. Sometimes it's the caregiver who doesn't want to give up the responsibility of taking care of a child or another sick person. And it makes for a unique relationship and it makes for an awkward conversation, but we'll work our way through it and we'll help you guys get out to the other end. So in addition to all the treatments and all the things that we offer in the doctor's room, we also have many therapies we utilize in the clinic. So there's two major things that we're looking for. It's looking for detoxification and energizing the tissues that help them get better. And we have many different therapies, as you can see here, as far as what we're using. And these will really help turn the corner a little faster. And so we're really excited to offer all these things and the treatments to really get some really good results with Lyme disease. And we've had some really good success and I've been through it myself, and so I'm very keenly aware of what you're going through.
Listen guys, we've had a lot of fun out here at the zoo, and we know that Lyme disease is a huge subject and there's no way to cover it all. We didn't even begin to talk about things like co-infections. If you're suspecting that you or somebody you love might be dealing with Lyme's, call us. We'd love to answer any question you might have or do anything we can to help you. Guys, we want to thank you for taking the time to watch our video. I strongly encourage you to check out Macy's story. It is an incredible story of recovery. It'll bring you to tears. And I also want you to call us for a free consultation for any way that we can help improve your life, whether it be Lyme disease or any other health condition.